Good day, ma'am. I am Toni de Guzman from Broken Shark College, BSN 4. This morning, I will perform the return demonstration in administering medication in intramuscular injection. So for the preparation, I will assess the client's allergies in any medication, the specific drug action, side effect, and adverse reaction, client's knowledge of and learning in needs about the medication, the tissue integrity in selected site, client's age and weight to determine the site and needle size, and client ability or willingness to cooperate. For the action, we have to determine whether the size of the muscle is appropriate for the medication to be injected, and then assemble the equipment and supplies. Check the label of the medication carefully against the medication ticket to make sure that we have the correct medication that was prepared. Follow the 3 checks in administering medication. Read the label of the medication against the order or the medication ticket, and that is when taking the medication from the shelf of the medication cart before opening or withdrawing the medication, and after withdrawing the medication, and then confirm that the dose is correct. For the procedure, first is to wash your hands and observe other appropriate infection control procedure. And then prepare the medication from the ampule or vial for drug withdrawal. And then provide privacy for the client. Prepare the client, ask the client to state their name, then check the client's identification bond. And then assist the client in a supine, lateral, prone, or sitting position depending on the chosen site. And then explain the purpose of the medication and how it will help, and also include the relevant information about the effect of the medication. Go! Good morning, ma'am. I am Toni de Guzman from BSN 4 Broken College. So let me prepare the medication first. Can you state your name, ma'am?
Hindi po
So, ma'am, I will give you a medication through intramuscular injection. So, this will, for the purpose of this is for the fast flow of the medication in your bloodstream. So, let me provide you some privacy. We have to include the relevant information about effects of the medication. Select, locate, and clean the site. Select a site free of skin lesions, tenderness, swelling, redness, or localized inflammation and one that has not been used frequently. If injections are to be frequent, alternate sites, avoid using the same site twice in a row, and then repeat the exact site for the injection. Put on clean gloves. Clean the site with an antiseptic swab using a circular motion. Start at the center and move outward about 5 cm or 2 inches. Then transfer and hold the swab between the third and fourth fingers of your non-dominant hand in readiness for needle withdrawal. Position the swab on the client's skin above the intended site. Allow skin to dry prior to injecting medication. Then prepare the syringe for injection. Remove the needle cover without contaminating the needle. If using a pref-filled unit dose medication, take caution to avoid dripping medication on the needle prior to injection. If this does occur, back the medication off the needle with sterile gauze, then inject the medication using a Z-trap technique. Ma'am, gusto ko muna. Holding the syringe between the thumb and forefinger, pierce the skin quickly and smoothly at 90-degree angle and insert the needle into the muscle. Hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back on the plunger with your dominant hand. If blood does not appear, inject the medication steadily and slowly by holding the syringe steady. After injection, wait 10 seconds. Withdraw the needle, move smoothly at the same angle of insertion. Apply gentle pressure at the site with a dry sponge. Do not massage the site. If bleeding occurs, apply pressure with a dry, sterile gauze until it stops. Discard the unscathed needle and attach syringe into the proper receptacle. And then remove gloves. Wash hands, document all relevant information. Include the time of administration, drug name, dose, bloat, and the client's reaction. Assess effectiveness of the medication at the time it is expected to act. So, we're done, Mom. Thank you for your cooperation and have a nice day.